Greetings and welcome once again to FHN's Community Update video. We're pleased to have you spend a few minutes with us to learn about all of the things that are happening throughout our community. This week, I'm joined by Gabriel Gonzalez, who is our executive in charge of our entire mental health, behavioral health program. But Gabriel is also a practitioner, so he's here to share some tips about back to school and some of the anxiety that many of us parents are experiencing and ways that we can better manage that. So Gabriel, thanks for joining us this week.
Going back to school can be stressful in a regular year. Making new friends, fear of acceptance, meeting with new teachers and not knowing how the teacher is, the new rules of the classroom. For some, the subject they're fearful of, like math and science, English, literature. For others, it is leaving the comfort of home and having to be confronted with bullying, drugs, sexual pressures. This year, we're adding the concerns about getting sick, having to wear a mask, staying home isolated from others. Each child will respond differently to that stress, but we need to recognize that this year presents some new stressors that we'll have to prepare our children for. There are some differences on how stress is expressed, mostly because we all respond to stress based on our experiences, the coping mechanisms that we have learned, and the coping skills that we have. So you can expect a child to respond differently than an adult in that manner. But our personalities and the ability to process the situation that is creating the stress is going to be very different amongst all of us, adults or children. We look for signs of changes in sleep, changes in their eating patterns, irritability in your children with limited understanding. Younger children, we're looking for how they process those emotions. We can see changes in their likelihood to play with other children, share their toys, complaints about physical pain, refusing to go to bed. For small children, they're attempting to gain some control over their lives when they don't understand that, which is similar to what adults are doing. We just express it a little bit different, maybe with a lot more irritability, more dislike to do activities that we usually would have done before. These are the understanding of how each individual is going to respond truly comes down to their experience around stress. Children need reassurance that everything will be fine. They need to know where to go get the answers. And finally, they need to know that consistency will help them reach some normalcy. And so a set schedule that allows for specific time to play, specific time to do homework, specific time to do schoolwork, family time, screen time, and sleep time, those are important. Even choosing the weekly menu ahead of time and making it repetitive can help children address and feel that normalcy. Parents can serve as role models for behaviors that the child will need to follow, such as responding on time, maintaining a healthy dose of social isolation, and utilizing the protective gear like masks, face shields, etc. It is important that parents check in with their children about how things are going and what is bothering them about school, but need to be very specific and not accept silence as an answer. Well, I always say that all stress is good stress. What is bad about stress is how we manage it. So stress is what tells you that there is a new input, that is a new change in your environment that might be creating some, we call in mental health, some dissonance around how your life is moving. And so the stress is just the signal. how we manage that signal, how we interpret that signal and take action on that signal is what is the alarming piece. We talk a lot about coping mechanisms or coping skills, and so stress is not bad. Which coping mechanisms we use is what makes the difference. For example, some people may choose to respond negatively by becoming irritated, screaming, procrastinating, isolating, and even hurting others. Some people might react to stress a lot more positively by identifying the stress, figuring out a plan to address the stress, and then taking action to lessen your current experience, your negative experience. And those are the things that will make the difference. So one of the things that I say to people is that you can go into Google very quickly and type coping skills, and there will be a list that you can try some. And if you want a more in-depth list and more in-depth conversation around coping skills, you can always reach out to your near mental health provider, or you can call us at the Family Counseling Center at 815-599-7300. So besides the knowledge and practice of coping skills, maintaining informed about what is happening around you, what is happening in the school where your child is taking courses, will help you feel more in control of the situation, thus making you less stressed about the reality that your child might be either taking school at home or a mix of that. Parents must watch for signs of increased and overwhelming stress. So it is not just stress, it's increased and overwhelming. The signs will look different in every child and in different age groups, as I mentioned before. In general terms, we're looking for changes in sleep patterns, changes in eating habits, increased mood changes, increased isolation, periods of extended daydreaming, like they are not really comprehending and they are spending a lot of time in their minds versus interacting in the world. Any changes in physical appearance, suddenly your child begins to wear clothes that never before, and that might be a way that they're expressing their concerns. And then things can get a little bit more difficult, like some self-injurious behavior, like self-cutting as a way to process some of that pain and some of that stress, some of the pain that comes from the stress, I should say. And then I would also look for increased bruising for those children that in the midst of stress might choose to start hitting themselves versus addressing it through coping skills. Depending on the level and the intensity of any of these above signs that you're going to be looking at, then you will need to make a decision about whether it's appropriate or not to bring your child to seek some professional help. The most important task is to recognize stress, recognize what it is and what is the level and whether it's increasing or decreasing. And that, unfortunately, requires a lot of self-recognition and the ability to really be present on who you are and what you're experiencing. And recognize that it's normal. Parents did not sign on to do homeschool or deal with children at school during a pandemic. These are abnormal situations. Give yourself a break. Take a walk from the immediate stressor. Practice some scoping skills. For example, take a long breath, go for a walk, take a cooling bath or shower, and then re-engage with your stress once the level has reduced to normality.
Unfortunately, we've seen a steady influx of positive inpatients over the past few weeks. However, we have not seen a significant increase that is directly corresponding with the overall increases we're seeing in the positivity rates, which are much higher in our area. Of course, that creates some concern because generally when we see those positivity rates increase, it's only a matter of time before we unfortunately see more hospitalizations. But hopefully we can avoid that. One of the observations I'll share my opinion about is looking throughout our communities as we're going out and we're enjoying a lot of this great weather that we're having. But I think sometimes people take for granted that being outside makes you safe, and it really just allows you more space to social distance. And where I've gone out to the parks and I've seen people playing baseball or softball, I notice the teams are sitting right next to each other in the dugouts. In the stands, people are very close together. And even after church, where people are very good about wearing their masks when they go into church and then get seated into their pews, they take their masks off, they're appropriately social distanced. But then as soon as church lets out, there are large groups of people that are congregating outside those doors, which fellowship is really important, and it's a very good thing to be able to do, but we need to remember to do that safely. So I think one of our bigger challenges is seeing groups getting together and not taking the appropriate precautions, especially when outside. The aerosolization is probably a good example of why it is important to maintain those precautions while you're outside. So for example, when you go to a sporting event, many of us like to cheer for our kids or cheer for our favorite team, but when we're doing that, we're really projecting out a lot of force from our lungs, which is carrying those droplets even further than if we're normally speaking. Another way to think about it is if you're standing outside, you probably can tell if somebody is smoking without even seeing it. That's the fact that you're able to pick it up by smelling, or if you watch somebody smoking as they exhale and you see the smoke moving through the air, you see how far that travels. Now thinking about that when you're in a crowd or you're in a group, if that person was a smoker, how close would you really be getting to them if you're not a smoker and be able to tell that there was something that was being spread? This aerosolization is going a lot further than people tend to presume, which really doubles down on the importance of masking to be able to prevent that spread. Well, one of the things that we know for sure about COVID-19 is it's going to change. And part of that is simply it's new. And as we have something new, we don't really understand it fully, and we're learning all the time. So there are many aspects of COVID-19 that we have not had the opportunity to research or to be able to study in depth, like we have with other viruses. Where the flu has been around for many, many years, there's a lot of data and there's a lot of information that's already available that we can learn from. But with COVID-19, it doesn't act like every other virus, and so it has some unique aspects to it which we're trying to stay ahead of or on top of to make sure that we're preventing the spread and trying to come up with the most practical and effective treatment protocols that we can. We'll continue to learn, and as scientists and doctors are working really hard, I'm sure these guidelines will continue to shift and to change, and we can only do our best to stay on top of those and make sure that we adhere to those guidelines. I talked about the different treatment protocols. Those have changed several times already in healthcare, and I expect that they're going to change as we learn more to figure out what works better and what's the most effective. We're also learning that COVID-19 may impact people differently based on different factors, and that's information we just don't have a clear picture on because it hasn't been around long enough for us to get that information. So the biggest thing, even though it's frustrating, is to try and be patient and to stay on top of credible research and those trusted sources of information like the Illinois Department of Public Health and the Centers for Disease Control. One of the things that we are very confident about is that masks do work because they actually stop the spread, or they cut down on that aerosolization from going out so far. So it's making sure that we do follow those guidelines, make sure we have appropriate social distancing or physical distancing, and we're also doing frequent hand washing. So we're making sure that we're creating as safe and as clean an environment as possible. especially if we're going to be in crowds. And remembering that just because we're just outside doesn't make us safe, it just gives us a little bit more room to spread out. That's a pretty complicated topic because there's a lot of ins and outs and there's a lot of details that are surrounding the Restore Illinois plan. At the time of this videotaping, we currently have 30 counties that are in a warning status. In our area, that includes Joe Davis and Carroll County. Where we haven't had more restrictions in place or we haven't been rolled back, it's certainly something, if we don't get this under control, we'll all be experiencing. One of the best places to refer to is the Illinois Department of Public Health's website, and we have a link of that available in this video. Here you can learn about the entire Restore Illinois plan as well as mitigation tactics. And that can be found at dph.illinois.gov, and click on the COVID-19 links. We'll give you all of that information. Again, we need to do all we can to keep those numbers from climbing. Some of the numbers that are commonly in the news that are very easily available to the public are the number of positive cases or the number of deaths. Two metrics that I look at pretty closely are the rate of hospitalizations, or the number of people that are positive of COVID-19 that have actually been admitted or are in the hospital, as well as patients who are in intensive care units on ventilators or respiratory type of assistance. So when I look at those hospitalizations and then I look at the number of people that are on ventilators or in the ICU, those are important for us to look at as a healthcare system, because we can be wary about what we have to do to plan and respond to it. It also tells us how serious the cases are with those positivity rates, how many of them are really getting sick or getting to the point of where it could be life-threatening. This year is definitely going to be different. What that means, I don't think anybody really knows. However, one of the frightening things of having two viruses available is that one could weaken somebody's immune system, making them more susceptible for the other. This is the year, more so than any other year, where it's important to get that flu vaccination. We want to make sure that people are being immunized to the best of their ability, taking all of those precautions, because as we move into fall, we are going to be starting to spend more time indoors, and the danger of that transmission really goes up. And the susceptibility for our most vulnerable population is going to be even higher this year. FHN will absolutely be doing our flu shots this year. We won't be doing those in the clinics as in the past, but we will be doing them through a drive-through process, making it much more accessible and convenient for patients, and also safer. We don't have so many people commingling or being close. And starting at the end of September, we already have 7 drive-through flu clinics available for anybody to come to. Information about that's available on our website, www.fhn.org. And we will be putting out more information in the media, but the website is really the most contemporary place you can go for information. And as we see the demand increase, we will potentially add more drive-through flu shot clinics or locations as well. The same advice that we've been sharing over the past several weeks. It's going to be a beautiful time of the year as we get ready to move into autumn. With a change of weather, a change of the seasons, there's so many things to do and to be able to enjoy, but we really want to make sure that we're enjoying that safely, because one of the other things that happens is we tend to spend less time outdoors and more time indoors in close quarters. Group gatherings tend to be in a little bit warmer environment that typically are inside. And so when we see those type of events coming up, or we find ourselves in these type of situations, we have to remember to wear our masks to make sure that we are socially distancing, keeping good hand hygiene, and keeping people safe, which means paying attention. If we're not feeling well, maybe we shouldn't be going out to that event. If it's going to be a big crowd, maybe we should not place ourselves in that big crowd if we don't feel we can do so safely. So as we move into this next season, it's really a word of caution that I would encourage the families through Northwest Illinois, but I would also not let that stop you. Again, there's so much we can do and so much that we have to enjoy this time of year, and we shouldn't let this stop us from being able to do that. And remember, social distancing doesn't mean social isolation. It is more important than ever that we are staying in contact with each other and helping support each other through this ever-changing environment. So stay safe and stay healthy.